So today, students, we're going to go through in Intro to CPT the respiratory chapter, the respiratory system. If we start with the very first page of the chapter, where it starts with the format, and follow along. It says the respiratory system subsection is arranged by anatomic site. So for example, nose, accessory sinus, your larynx, and then the procedure, what we're having done, incision, excision, introduction. Your knowledge of respiratory terminology is important as you assign codes from the respiratory subsection. Again, the more time you take now to look something up if you don't know, the quicker you'll be in advanced coding. You have the time now, take it. Make sure you know your stuff before you move forward. In the musculoskeletal system subsection, it says arthroscopy codes are placed at the end, but in the respiratory system subsection, the endoscopy codes are listed throughout according to anatomic site, so they're not all bundled together. Fracture repair, so we're talking, nose and sternum there, is listed in musculoskeletal, not in respiratory. Procedures that are performed on the throat and the mouth are not in respiratory, but instead they're in digestive. So a few points there to try to, make note of. The respiratory subsection contains some codes that may be considered cosmetic. Rhinoplasty or nose job, 30400. Is a big deal. Basically, you can read through that chapter on your, or that paragraph, on your own, but we do need to be very, very careful with the medical record. Again, we'll say this a million times in the program, if it's not documented, it's not done, and we need to be sure in that medical record that we have medical necessity for doing things like this. On the next page, endoscopy. During endoscopic procedures, that very first sentence is super important. It says the scope is placed through an existing orifice. Okay, so through an existing orifice or a small incision, okay, can be made into the cavity for scope placement. The biggest deal with endoscopies is the furthest distance needs to be noted, and we use that for coding. The furthest distance meaning the furthest distance that the scope was placed. And that next paragraph talks about that. You need to be careful and make sure you read through that. There's a few cautions, and actually all the cautions on this page I think are really good, and I have note of code the fullest extent, or the fullest, the farthest extent of the procedure. Code the correct approach. You need to be really, really careful and be slow and read carefully with your medical terminology here that comes into play. It's all about where you start in that index to find that correct code, right? So for instance, a tomy, okay, the suffix tomy is open, but a scopy means that a scope was passed, right? So you have to be very, very careful when you're starting in the index to make sure you get to your correct code selection. So that middle caution there says code the correct approach. That's being really cautious to those suffixes that really change our code selection. And they give a few examples about that. I think in the middle of those paragraphs there beside it talks about a thoracotomy and a thoracoscopy. Again, the tomy and the scopy and the differences and the differences that'll make in your code selection. So be very, very careful. The last caution there says, do not confuse nasal or sinus endoscopic procedures with intranasal procedures. Intranasal procedures may require surgical instruments be placed into the nose, but don't necessarily require that actual use of the scope. When an endoscope is used, assign the endoscopy code. So anytime we have that scope, we need to code for it. And then at the very bottom of that page, we talked about this last week as well. Remember, a diagnostic endoscopy is always bundled into surgical. If they go in looking to see what's going on and they find a polyp that needs to be removed, that just became a surgical procedure and needs to be coded as surgical procedure. We would not code the diagnostic. Okay, so very good information for you to read through on these first few pages. If we turn the page, It gives a little example there of when we can bill both the diagnostic and the surgical. It says, if a diagnostic sinus endoscopy is performed on the right maxillary sinus, so diagnostic on the right, and a surgical endoscopy, a maxillectomy or endoscopic maxillectomy was performed on the left, well, then you would report both. And the way that we can delineate between those two is our RTs and our LTs, our lefts and rights for modifiers. So that, make sure you make that make sense. We talk about indirect and direct, okay, with laryngoscopic type procedures. Indirect are two very key terms that are noted in the code descriptions in your code book. So we talk about 31505, that's indirect. It says, it means your physician used a tongue depressor, okay, to hold your tongue down and view that epiglottis with a mirror. The patient vocalizes, says, ah, and then the physician can view those vocal cords. Direct means that a scope was placed. They directly, right very close up and personal with the scope, viewed, and that's a different code selection. So you got to be careful with those two terms. Locating endoscopy codes. Endoscopy codes can be located in the CPT under endoscopy and then going, okay, to your anatomic term of the site. You can also locate it by anatomic endoscopy title. For example, a bronchial biopsy using a scope endoscopy is bronchoscopy, which is really hard for students right away because the title of what was done and the note sometimes isn't exactly where we'd start in the index. And that's a perfect example. A bronchial biopsy using the scope, we can go right to bronchoscopy and you think, okay, yeah, that was what was done, but they didn't say it that way. Okay, so sometimes that can be the hardest battle for coders. When we talk about nose, epistaxis, nosebleeds, okay, comes to mind here. Incision. I have a little note here that says, when we read this, is it skin or is it respiratory? You really need to read the chart. The very bottom of that page, they say, if a nasal abscess is approached from the outside of our nose, okay, an external approach, it comes from the skin, right? Your code's going to start with a 1, integumentary system. But if your approach is from the inside of the nose, an internal approach, then it comes from the respiratory subsection. So you've got to be careful. And again, your medical record, okay, is where you find that kind of information. At the bottom of that page, it talks about biopsy codes, okay, intranasally or outside. Again, is it coming from the respiratory, which these codes all start with the 3, okay, this week. And then, is it coming back integumentary? It's something in the skin of the nose, then it's, starts with a 1 and it's the integumentary system. If you turn the page, we talk about nasal polyps. Are reported with a couple of different codes. The difference between these codes is the extent of the excision. 30110 reports a simple polyp excision. It says it's usually performed in the office, where 30115 reports more extensive, and that's you need to be in the hospital setting for that. Lots of really, really careful documentation. Right above introduction is a paragraph with the bold heading turbinates. Turbinates are the bones inside of our nose. These bones are shaped like spiral shell. They humidify, warm, and filter the air. These bones are referred to as the nasal conchae. The turbinates are divided into 3 sections. We have inferior turbinates, middle turbinates, and superior turbinates. Portions or all of a turbinate bone may be removed because of chronic congestion. Neoplastic growth is another reason, it says. Because third-party payers usually don't pay for cosmetic surgical procedures, you really, really have to be careful with the medical necessity for these procedures to prove they are non-cosmetic. We really do have issues and we need, this taken care of. It's not that I just don't like the way my nose looks and I want a nose job. Okay? Very different there. With introduction, we talk about displacement therapy, and I want to scroll down here. I have some videos that I'm going to place. I don't have them on here yet, I see. But I've got some videos that I want to place here. One's a neti pot. a demonstration that comes to mind. I think this one was like 3 minutes long from Oprah from YouTube. I'll put the links on the content here as soon as I'm done. Displacement therapy. At the bottom of that introduction paragraph, it says displacement therapy 30210 is a procedure where your physician flushes saline solution into the sinuses to remove excess mucus or pus. They talk about inserting, a button, a nasal button as well, and they talk about how to do that, and they show a little picture of it up on the next page as well. But displacement therapy really is using the neti pot. I don't know if any of you have used that before, but it's super interesting to kind of watch, and it usually creates a lot of good discussion if we were in class talking about this. Removal of foreign bodies, you think about the Lego or the pea or whatever, the button up the nose. There's codes for that, so make sure you read that carefully if it did not require anesthesia or if it did. Repair. And it's important for you to read about rhinoplasty there and septoplasty, but really repair in skin is getting stitches, right? Okay, we learned that in the integumentary system. Repair in respiratory is really getting a nose job, or repairing something in the nose, having that rhinoplasty. Okay, so note the difference between those two. Turning the page, other procedures, we think of nosebleeds or epistaxis, complete hemorrhages, okay, there, whether we need to pack them or not packing. We talk about that there, so that's good for you to read as well. When we talk about accessory sinuses, this is a little more in depth than the neti pot. Incision there, it says within incision category are codes for services you think of not really being as incisional. For example, the nasal sinuses can be washed or lavage with saline solution introduced through a cannula or hollow tube to remove infection. We look at the differences between a couple codes here, and I kind of have a little recipe written down. I remember my provider would write this out and give it for people to take home with chronic sinus infection and sinus pain, and I think we're at that time of year right now for a lot of us. And it's pickling or canning salt. It has to be salt that doesn't have iodine in it is the kicker with that. And then baking soda and distilled water, and you boil that, and then you can even use, I did do it once, and you can even use the nose sucker, okay, from a baby. That's what I did. And, squirt it or put it into, one side of the nose, and it will wash through and clean those sinuses if you have infection or to prevent infection. A lot of people, if you want to dig around on YouTube a little bit, there's a lot out there really about those kind of things. And I want to show you something really quickly here in our encoding system. Oh, if I can get it up, here we go. I want to get to my references here. In the references spot, hold on, can't talk at the same time. Okay, Coder's Desk Reference. A Coder's Desk Reference is actually a book that I always had it as a book. Now we have it and it's included in our encoder that we use, in our second year of coding. But using CPT codes, oh wait, no, I want CPT lay descriptions. 30210 is the code I want to look at. Try to move this so you can see everything on the screen. Oh, it doesn't, kind of goes off. It says your physician displaces mucopurulent secretions from sinuses by gravity replacement with a second liquid. This therapy is effective for, I'm going to try to move my screen here, for the ethmoid and sphenoid sinuses. While lying supine, the patient's head is hyperextended, the nose is filled with this isotonic saline solution. The doctor closes one nostril, applies suction to the other nostril. The patient repeats vowels or words, elevating the soft palate and creating negative pressure back there. While the patient is phonating, then the physician suctions the nostril, the saline solution enters the sinus, displacing the secretions, cleaning it out, and then they're all suctioned from the nostril. I also want to look at the code 31000, and I'm almost out of time, so I need to hurry up. 31000, if I can find it in time. I have to make another code here quick. This says it's irrigates infected sinuses through the cannulas. And we can read through this. This is a great reference for us, the desk reference.